Your Excellencies, distinguished delegates, colleagues, ladies, gentlemen, and students. On behalf of World Information Transfer, I would like to express our deep appreciation to the government of Ukraine for co-sponsoring the 22nd International Conference on Health and Environment, Global Partners for Global Solutions, and the missions of Hungary and Singapore for supporting it. I would also like to express our gratitude to His Excellency Yuri Sergeyev, Permanent Representative of Ukraine, Mr. Thomas Gass, Deputy Secretary General for Policy Coordination and Interagency Affairs, UNGA, Mr. Nihu Seth, Director of Division for Sustainable Development, UNGA, our esteemed speakers, and the University of Westchester for bringing a couple of busloads of students, the future of this planet. World Information Transfer is dedicated to the studying the connection between environmental degradation and human health, and in identifying solutions to remediate our environment, and by doing so, improving the health and quality of life of Earth's citizens. Each year, for the past 22 years, I have been reciting a list of accomplishments that have galvanized the global community to attain sustainability. Unfortunately, with all the knowledge that all of us have gleaned, most of our leaders still do not have a deep connection to the Earth, and our planet is continuing to degrade, as well as the health of its inhabitants. The world can get along, as Dr. Robert Solow of MIT stated, without natural resources. So exhaustion is just an event, not a catastrophe. But can the inhabitants? Can we? We have been listening to the ills of our planet since 1972, the first United Nations Conference on Human Environment in Stockholm, Sweden, and have been conscious that we are living at the expense of the future by exhausting the resources that will be needed by the future generations. We continue to contaminate the air that we breathe, fill our land and water with waste disposal, destroy our forests at an unprecedented rate, erode our fertile soil, destroy our ozone layer, and continue to exacerbate our climate and the extinction of millions of species. We thought that environmental problems were attributable to ignorance, inadequate government, administrations, and multinational companies. To some extent, this is still the case. There are countries that lack the necessary technologies due to many difficulties that they are facing, including lack of enabling environments due to the lack of good governance and rule of law and population explosion. Others still profit from the sale of pesticides and dumping of toxic materials in the developing world. We have learned that environmental issues are of international concern and need international collaboration. However, this growing awareness is progressing at a much slower pace than the destruction of our habitat. A social order that was created by cultures without fundamental world justice cannot sustain itself. We need to change the culture, whether one of consumption or one that gives rise to increased populations. Both are unsustainable. Our present civilization, our culture, our values are endangering our world, and it is up to the young generation, those that will lead the future, to galvanize those that are unable or unwilling to attain a culture that will benefit future humanity. That is why I am so proud that each year at our conferences we have large numbers of young people, as they need to hold all of us accountable, since we already live on their expense, and those who will come after them. In conclusion, I would like to end with a quote from Jonas Salk, medical researcher and developer of polio vaccine, who, when asked who owns the patent for this vaccine, answered, "Why, the people." Thank you. Okay. I wanted to mention that this session is webcast, also that all of the speeches are going to be on the internet. All you need to do is check with our immediate director. And at the present time, I would like to introduce Ambassador Yuri Sergeyev, is the permanent representative of Ukraine to the United Nations. Mr. Sergeyev has been the permanent representative since May 2007. Prior to that appointment, he was ambassador to France, during which time he was also permanent representative of the United Nations Educational, Scientific, and Cultural Organization, UNESCO. Ambassador Sergeyev has also been the Secretary of State at the Ministry for Foreign Affairs, the Ambassador to Greece and Albania, and headed the Foreign Ministry Directorate for Information. Your Excellency.
Thank you, Dr. Durbach, for introducing me. Dear colleagues, distinguished guests, I am honored to represent Ukraine as a co-host of this essential open dialogue at the United Nations that give us an opportunity to discuss a number of the most relevant items of the United Nations Development Agenda. First of all, let me thank the co-organizers of this event, Dr. Kristina Durbach, and the World International Transfer for being sustainable host and partner for these conferences during the long 22 years. I would also like to welcome our distinguished speakers of today, Mr. Nihil Set, the Director of the UN Sustainable Development, the representatives of the missions of Hungary and Singapore to the United Nations, and our colleagues from academia, Princeton and Columbia Universities, and from the Electric Power Research Institute. Dear colleagues, Ukraine is confident that broad international discussion within the United Nations is a fundamental element in order to frame the national and global priorities for the future development programs of the United Nations. The topic of our conference is sustainability risks. However, let me say a few words that World Sustainable Agenda is a long process, which was started almost 15 years ago. In the year of 2000, the United Nations Millennium Declaration defined a global vision of the development in the form of the Millennium Development Goals, MDGs. These goals have a clear system of targets and indicators as well as time frames for achieving them. Reaching the MDGs means real changes in people's living standards. In September this year, world leaders gathered in the Special General Assembly event to discuss the efforts made towards achieving the MDGs. It was highlighted that with the 2015 target date of the MDGs fast approaching, the outcome document should focus on existing gaps and weaknesses of the MDGs, accelerating of implementations and looking forward to the post-2015 development agenda. The country stated that during the past 13 years of two left, we have achieved a lot, especially in poverty eradication and health care. Since 2004, and being the first post-Soviet country to adopt the MDGs, Ukraine has prepared a number of annual monitoring reports. In September 2013, Ukraine presented at the United Nations its third national report on acceleration of MDGs. This publication incorporates the assessments of 200 leading experts from various scientific, economic, and research institutions. It is also available online. Dear colleagues, there is no doubt that every developing nation is striving to reach Millennium Development Goals and incorporate successful achievements into the post-2015 development agenda. It means that in 2015, after the MDGs are achieved, the member states will need the new guidelines for their post-2015 agenda. It means that we need to elaborate the Sustainable Development Goals, SDGs. The UN member states are now in a challenging process of outlining their positions to the issues of sustainable and inclusive economic growth, macroeconomics and infrastructure development, as well as climate change, health, gender equality, and many other topics. I am sure that Director Nihil Set has much more to explain, being the UN captain for the MDGs and SDGs. But I have to add that Ukraine, as well as other UN member states, are now in a challenging process of outlining their key priorities for the potential development strategies for the next decades. I would emphasize that Ukraine supports the activity of the General Assembly Open Working Group on Sustainable Development Goals, where countries can discuss their SDGs priorities. By the way, its 5th session was ended successfully just last week, and Ukraine has presented its view on an energy issue. We are confident that national economies should grow and social standards should rise in the future decades. Therefore, energy should be definitely included into the SDGs agenda. However, energy item for Ukraine's economy is a multi-sided issue and has the diversified approach for the energy supply and production without compromising its sustainability. Renewable energy is becoming an integral part of the energy system. However, because of the cost and infrastructure still remains a challenge. Ukraine's reliance only on alternative or renewable energy sources or burning of fossil fuels will not resolve economic and social development issues in the future. By saying that, I mean that over 50% of energy supply in our country is produced by peaceful atom. We believe that sustainable nuclear energy approach should be taken into account by the member states, especially those which rely on such technology. The new approach must ensure comprehensive consideration of security, social and environmental aspects, particularly in priority areas such as ecological safety, comprehensive environmental conservation, and prudent management. Only such approach will facilitate sustainable development of energy, especially as regards efficiency and safety of its nuclear sector. Having Chernobyl resolution on the General Assembly agenda, we are confident that immense experience of almost 30 years of long activity of how to manage and revitalize the nuclear accident consequences should not be lost for the international community. Dear colleagues, I try to shape the main ideas for the Ukrainian delegation in the United Nations Development Agenda. And now I guess that it is time to listen to the views and approaches of distinguished colleagues here. Thank you.
Thank you, Your Excellency. Thank you, Your Excellency, for giving us an update on the sustainable efforts of Ukraine, which basically has co-sponsored this conference for 22 years. So, before we continue, I would like to remind you that it has been our tradition not to take questions from the floor. Please fill in the questions, and the monitors will collect them, and then all the speakers are going to be able to answer them. Thank you. I would like to present to you now Mr. Nihil Set. Mr. Set is the Director of Division for Sustainable Development, Department of Economics and Social Affairs, DESA. He was also the head of the Rio Plus 20 Secretariat, where he spearheaded the preparations for the UN Commission on Sustainable Development Conference in Rio. With over 20 years of service to the United Nations, Mr. Set has served as Special Assistant and Chief of Office to the Undersecretary General for Economic and Social Affairs, Secretary of the Economic and Social Council, ECOSOC, and the Second Committee of the General Assembly, and as Director of DESA Office for ECOSOC Support and Coordination. Before joining the UN Secretariat, he was a delegate to the UN in the Permanent Mission of India and involved in various UN conferences and summits, including the Rio Summit on Environment and Development, the Copenhagen Summit on Social Development, the Monterey Conference on Financing for Development, the Mauritius Conference of Small Island Developing States, the Millennium Summit, the World Summit on Sustainable Development, and the UN World Summit. Mr. Secretary.
Thank you, Christine. Ambassador Sergeyev, distinguished other representatives on this podium, all you young people out there, ladies, gentlemen. I've been coming to this conference now for several years, and it's such a pleasure for me to be with you and to interact with you and to learn what are your concerns and your priorities. I can, of course, bring to you what are the kind of priorities that the UN is focusing on and how we are looking at this rather complex issue of sustainability as we go ahead. As you know, as Ambassador Sergeyev has mentioned, we did define a set of goals some years ago, 13 years ago, which were called the Millennium Development Goals, and they focused on the basic human deprivations. They focused on issues like poverty, on hunger, on health, on education, on gender equality and empowerment, of environmental sustainability. But what I would challenge you all is to think of the poorest person you've ever known, and to think, what are the forces that act on this person which prevent him from moving up by giving a life of dignity, a life of respect, a life where his hunger, his other needs are taken care of? What are the complex forces that act upon this individual? I'm giving you this challenge only because I want to help you find a segue into what the UN is doing of defining a post-2015 development agenda, which not only looks at the minimum deprivations as we defined in the MDGs, but we go much beyond. And in doing so, let's look at the individual. Let's look at this poor person, the poorest person you've ever met, and let's look at the forces which are acting on him or her. Now, clearly, of course, it's poverty, it's income poverty, it's hunger, it's education, it's health, lack of facilities, access to health facilities. It's the environment that is working against him. It's the oppression, the inequalities that they face. It's the discrimination that is faced in many communities in poor parts of the world. But there are a whole set of other forces acting on the individual. It's the environment he lives in, the kind of sanitary facilities, the availability of water, poor air quality, the threat to life and limb, the lack of security. These are the second set of forces that are acting on this individual. And there are a third set of forces acting on this individual, and these are called the slow onset events. Events like climate change, events like the sort of state of our oceans and what that is doing to the availability of protein and nutrition to them. It's the loss of biodiversity. It's land degradation. So you have these three sets of forces which are acting, which are preventing this person from breaking out from the cycle of poverty and deprivation and to moving into higher trajectories where that person can enjoy a life of dignity. So how do we address these challenges? How do we make sure that by 2030 and beyond, none of these forces operate on this individual, where the individual can break away from all these deprivations to live a life of dignity? And for that, the UN is now grappling with what they call the Sustainable Development Goals. Goals which go much beyond and look much more deeply into these issues than the Millennium Development Goals did. And here, I want to come to the concept of sustainable development, because sustainable development essentially looks at these forces which are economic forces. These are forces which meet the economic aspirations of individuals. There are the social forces, social aspirations of people to move up on the social ladder. And of course, there are these other environmental forces which prevent that individual breaking out. So it's this intersection of economic, social, and environmental forces. And unless they are seen in their totality in a holistic way, we are not going to succeed in breaking out from this trap of poverty and deprivation. So sustainable development is a tool to look at, in an integrated way, of decision-making and other processes which will meet people's economic aspirations, because that's at the core of people's, what motivates people, their economic aspirations, to look at their social aspirations and to look at their environmental fears together in a holistic way. And that's what we are trying to do in the Sustainable Development Goals, to look at the whole series of issues, the intersections of these issues. It's for these reasons that I'm very happy that your topic today focuses on two crucial issues, on health and the environment, because these are very closely intertwined and you can't discuss one without looking at the other. And we know what these intersections are, but it's our ability to see these intersections more forcefully and in all the kind of cross impacts they have on each other, the negative and the positive spin-offs that they have on each other, which is so crucial. And I see from your program, you have a rich program where you're looking at different facets of these intersections. So the way in which you discuss these, the way in which you see these, the way in which you develop ideas around these intersections, that is the core of sustainable development. So it's very important that while you're looking at sustainability issues, on the issues of environment and health, you do explore all these issues. Now let's look at what are these intersections between environment and health, and how can we have a mutually reinforcing process where taking actions on the environment, taking actions on health will be mutually supportive to each other. Let's look at local issues. I want to go into the global commons issues, issues like climate change and oceans and land deforestation, loss of biodiversity and so on a little later. But I wanted to first look at the local impacts of what are the forces, intersections between environment and health. First, I think in large parts of the world, sanitation is such an important issue. And open defecation, the billions of people who don't have a toilet, and what that does to the local health is appalling in terms of dysentery, other diseases, the deaths that causes, how all this gets into the water system, and the kind of impacts that have. So I would say clean sanitation, safe sanitation is one of the most important environmental intersections with health. The second, it was mentioned, I think, by the ambassador, that the whole issue of waste management, particularly in cities, is going to be a very important determinant of the sanitary conditions in which people live. The third is air quality. We know how, for example, issues like motorized transportation, factories using not very clean processes of production, what that does to the particulates in the air, and how that impacts upon health, the respiratory health, the rheumatology, the illnesses which are generated by this lack of clean air. The millions of women and children who die because they use not clean cook stoves, they use biomass for cooking, and what that does to the smoky environment in small homes and the impact that has on people's lives and that quality. Then, of course, the whole issue of water quality, the issue of chemical pollution, the issue of the kind of urban congestion we live in. And remember, as we look to the future, because this, of course, sustainability is your agenda. It's an agenda for the young people. It's an agenda for the future generations. And as we look 20, 30 years into the future, urbanization will be one of the most strongest trends in changes in the way people live and work, and how that is going to impact on the infrastructure of cities, and how all these things that I mentioned on sanitation, on water, on air quality, and on chemical pollution, on particulates in the air, how all those are going to make, in a large part, particularly of the developing world, urban hell for people to have a healthy and healthy life. So these are forces that will be acting at the local level. And on many of these solutions have to be local. They have to be done by the mayors, by local governments, by municipalities, by citizens groups, who have to focus on the ways in which the air quality has to be improved, in ways in which the water quality has to be improved. So these forces are going to be acting very strongly. So these are the local manifestations of the impact of the environment on health. Then we look at the global issues, issues like climate change, what that's doing to vector-borne diseases, increasing temperatures, and what that means for malaria, for example, and what that has to do with water availability, and so on. So there's a whole set of issues which are generated by our lack of taking serious action on mitigating climate impacts and how that's impacting on local health. And this is an issue which is not given as much prominence as it deserves. When we look at climate change, we normally switch our minds totally to the water issues, which is on melting ice, on rising sea levels, on extreme weather events. But all these have deep implications on human health, which must not lose sight of. And on oceans, what we are doing by overexploiting our fish stocks, by making less protein available to people, and what that means for nutrition and health. So there are lots of intersections, whether you look at global issues or you look at local issues, and the impact that has on human health. So health is at the core of sustainable development. It is a right and a goal in its own right. It also means, it is also a means of measuring success across the whole sustainable development agenda. That's why it's important for a meeting like yours to bring to the governments the importance that the health agenda is in meeting the needs of the future we want, to meeting the healthy needs of our future generations. Health encompasses broad well-being. It's not only the absence of diseases. Universal health coverage and equitable access to quality basic health services are issues raised by many governments and by non-state actors. Other important issues which have come up in the UN's consideration of how to look at sustainable development goals are health promotion, prevention, and treatment. Communicable diseases are still a burden in many countries, but non-communicable diseases increasingly affect all countries, highlighting the need to promote healthy diets and lifestyles. There is a need to address access and health needs of persons with disabilities. The discussions that are taking place between governments have highlighted the importance of equal access of women and girls to healthcare services, including addressing women's sexual and reproductive health and ensuring universal access to safe, effective, affordable and acceptable modern methods of family planning. Aging populations is the other big demographic trend, which is posing a major healthcare challenge in many countries. There is a overlap between health risks facing the young and the old. So how do we break through all this? How do we get these intersections? We should focus on getting basic health services to all. We should focus on global partnerships for health and for the environment. We've tried over the past so many years to integrate these economic, social, and environmental issues into this theorem of sustainable development, but the time now has come. And I think your deliberations here, your ability to bring these forces together, to break down the silos which have often helped look at environmental issues separately, health issues separately, education issues separately, inequalities issues separately, to bring them together in a comprehensive and an umbrella sustainable development goals and a post-2015 development agenda will help shake up the governments into viewing things differently, of reorienting their decision-making. So I hope that your wonderful agenda today and your ability to look at different aspects of this problem will enrich the way in which governments also will ultimately look at these issues. And I hope you do find a way. You're a consultative, you've got consultative status with ECOSOC, and I hope the World Information Transfer will be able to bring the messages you hear at this meeting to the relevant bodies to make sure that in our pursuit of this overarching agenda for the future, for the next 30 years, we have these perspectives brought together in a sensible and meaningful, policy-oriented way, in a way which inspires policymakers, which inspires people, which inspires communities, and brings about the change that we want to see in the world. Thank you, Christine.
Thank you, Mr. Seth, for a very inspirational presentation on all the forces that prevent changes in achieving sustainable development. We hope that we will be able to mitigate some of them shortly. And our next speaker is one of our board of directors, Dr. Scott Ratson, who is the Vice President in Global Corporate Affairs at Anheuser-Busch. He is a public health pioneer and has made significant contributions in the advancement of public health policy through communication and health diplomacy. He co-authored the definition of health literacy and instituted innovations in mobile health communication. In his efforts to improve public health domestically and internationally, Dr. Ratson is the editor-in-chief of the peer-reviewed Journal of Health Communication, International Perspectives, and serves as a co-chair of the United Nations Secretary-General Every Woman, Every Child Innovation Working Group. He also maintains faculty appointments at Columbia University, Tufts University, School of Medicine, and the George Washington University. Dr. Ratson received his MD from the University of Southern California, his MPA from the John F. Kennedy School of Government, Harvard University, and MA from Emerson College. Dr. Ratson.
Thank you, Dr. Durbeck and Ambassadors, Excellencies, distinguished guests and panelists here. And ladies and gentlemen, it's great to be here, and hopefully in the next 20 minutes, and I promise the chair that I will look for the signals of when time is up, to share some ideas for the post-2015 world in an area that we've been working on called Inspiring Smart Choices. So I'll try to go quickly. I will mention I work for AB InBev, which does stand for Anheuser-Busch InBev. It's the world's largest brewer. And listening to both water and other areas, we are engaged with water and agriculture and energy and all sorts of activities. But health is what I'm trained in, and I'm going to speak as a public health physician here today about a variety of areas. So if we go to the next slide, please. Health is the most important foreign policy issue of our time, has been spoken in many places. The Lancet is a strong public health journal, and I'm going to talk about, again, post-2015, role of health literacy, and some new ideas. The next slide reminds us of the threats that we face in sustainability. And we've been talking about some big ideas, and Ambassador on my left started very quickly on the challenges that we face in obviously the area of water and environment. But if you look at what the World Economic Forum did a few years ago, they wanted to see what are the risks and what are the likelihood. And a lot of these, of course, were economic based of price collapse and oil shock. But if you push the button one more time, please, it reminds us that chronic disease, something that's preventable, is a likely risk that we face, will cost the world a lot of money. Developing world diseases are in the middle. If you hit the button again, please, it just circles that we could have a pandemic that can threaten all sorts of transportation and ability for anything with cross-border trade and what have you. And finally, smack in the middle is something that we see each day, or hear each day, of climate change. All of these have health and environment issues, and it's no surprise that World Information Transfer is engaged in the center of this. The next slide, please. But it's a challenge for people dealing with sustainability. And if you push the button again, how many legs does the elephant have? And the world we live in here is constructive ambiguity. Is it water? Is it energy? Is it education? Is it health? Is it infectious disease? And all of these obviously are intertwined. And here at the United Nations is the right place for this kind of dialogue. Now, the Director General of the World Health Organization, Dr. Margaret Chan, reminded us of health as a component in sustainability. And you can read her quote here. I think the key here is that health contributes to stability and is a foundation of prosperity. And if this were a strong economic group, we can show up to 20% of GDP in some countries being spent on health. But sustainability challenges and health have found their way twice now in the United Nations here. First with the HIV crisis, and second, which was in the early 2000s, despite the fact that it was over almost 15 years at that point. But the 2011 UN General Assembly on Non-Communicable Diseases reminded us of the real challenges. And without going into great scope here, it's clear that the UN resolution and the member states agreed that the quality of life and the most prominent non-communicable diseases are linked to common risk factors, and those are determinants in our society. And the final bullet point here is part of the resolution and political declaration that was supported both by, well, all of the countries in the end, but with the great work of Switzerland, G77, China, US, EU, and others, to again focus that health is not just science and medicine, but also has what I added the italics, health education and health literacy in there, and that's the next phase of what I'd like to talk about today. How can we galvanize society to look at health literacy? So there's been a lot of talk on that. And after World War II and the Bretton Woods organizations were set up, the WHO has a preamble that reminded us that it's about informing people, informing opinion, and active cooperation. Getting people engaged on the part of the public are of the utmost importance in the improvement of health of the people. Despite that, we often have a top-down approach in many countries, but now we're having more engagement. And the ministerial declaration at the UN ECOSOC in 2009 reminded that health literacy is an important factor for ensuring significant health outcomes, and in this regard called for the development of appropriate action plans to promote health literacy. The Chinese health minister spoke about that. They have 66 measures. Other countries have measures, and the United States now has a measure for health literacy as listed in the current Affordable Care Act. And this is the definition that the U.S. has adopted. And if you push the button 4 times, it shows that we have to obtain, interpret, understand, and make appropriate health decisions. This is a definition I worked on with co-author Ruth Parker. This is a foundation of a national action plan. 34 states and the European Union member states, 14 countries, and Switzerland have also conducted surveys on health literacy. There is a belief that if you give people not only education, but also change the system in a way that makes it simpler, better health decisions will be made. And that is identified in the next slide, which shows a very, very simple approach. Health literacy is not just about what you learn in school, and it's not just about making the system simpler, but it's bringing those together in the center into what's called a health literacy framework. And that's where a lot of groups have been working. How do we do that better? And the next slide gives an idea of how this impact exists. And I said at the outset, I'm a public health physician, and if you ask me what were the 3 biggest examples of what has made a difference to expand life expectancy, in some countries doubling where it was from last generation or last century to this generation, it's not what you would think I would answer as a scientist if I were one, by saying it were the advent of antibiotics. It's not the answer as a physician of giving people vaccines, although we have eliminated smallpox and are close to getting rid of polio. It's education, and it's particularly women's education. And the study here that I point to, the systematic analysis of 175 countries for over 30 years, or nearly 30 years, that the Lancet published, showed that more than half of the reductions in child deaths are linked to gains in women's educational attainment. Hence, not only UNICEF and others who work here, but the continued focus on building education and building a health literate society will make a huge difference. And it also has an impact on the whole community's well-being, on elimination or eradication or whatever term you like to use to lift people out of poverty. And we know that it can make a huge difference in social development. So our hope is that we move from health literacy to a broader agenda. And the next slide suggests that. How do we do that? Well, I don't know if anybody wants to translate this, but to me it's not you can have your cake and eat it too, right? It's a pie in the sky. I don't think it's a difficult idea that we could have sustainability with health literacy if we start to link health and education and diplomacy, which is a lot of what we're doing here today, and I'll have some slides that elicit that, and that's actually what, and I thank Christine for the intro on the Innovation Working Group. We tried to look at some of that for the Every Woman, Every Child initiative, and I believe the post-2015 Sustainable Development Goals, we can similarly reach for the pie in the sky. So the next slide is something that you might say, wow, this is out of sequence. Nobody said road safety. United Nations is involved with road safety. World Health Organization involved with road safety. Well, a non-communicable disease, and the next slide shows the numbers for what the situation is with road safety. It is the 8th leading cause of death today, road safety accidents, and projected by the UN to be the 5th leading cause of death, being higher than diabetes and certain cancers by 2030. Now, what's being done in that regard? There's a lot of different things that could be done, but I'm going to post some ideas where I think this smart choice idea can help make a difference. And when you go to the next slide and even see these demographics on road safety, it shows that engineering and science and development can make a huge difference. So look at the share of vehicles in the world. Right now it continues to grow in countries that were not set up necessarily for vehicles as long as the United States has. So 80% of the traffic fatalities are where 52% of the vehicles are, so middle-income countries. And as you see at the bottom, I put that I've been showing this internally to show that we have a responsibility in countries where we are, that we're having more road accidents than we've seen in others. And as you can see, middle-income countries have this without investment in these other areas. The next slide shows even more troubling for those of you. I think we have if I can say, a younger skewed audience here today. But the number one cause of death for people aged 15 to 29 are road safety accidents. So looking at that in the middle and looking at a disproportionate approach, perhaps for a variety of reasons involving men, and for another variety of reasons, not even involving the person who's driving the car. There's lots of things that can be done, and this is a non-communicable disease opportunity. So the next slide gives some suggestions about how we approach road safety. We don't just do this with engineering roads or having cars with airbags all around them, but we do come up with some ideas that might be able to make a difference, and these are scientifically based on a variety of fields. Many of you are studying them, many of you are engaged in them on a daily basis. Social psychology, sociology, public health, demography, communication, all of these are necessary. So some new areas in behavioral economics that supposedly help people move to make appropriate decisions at a time when it makes it an easier decision. We think that in the public health field we can help people make smarter choices by integrating these. And a couple more slides show exactly how this could be done. So we've come up with a smarter choice paradigm, and I'm saying we. I've been working on this with Dr. Allison Goldberg, who's sitting in the front row with me here at AB InBev, but we're also looking at this from a big academic standpoint of how the individual interacts with the environment and the system, and they're all intertwined. And we believe this can be done in a way that really helps make decisions on a daily basis. The next slide shows what some of these might be. So what do we eat inside and outside the home? What is safety like on playground or in sports and recreation? Do you wear a helmet? Do you have necessary precautions? What are the medical decisions that need to be made, whether it's screening, getting a flu shot, which I know everybody in this room has not had by almost definition of any good group. Social engagements. I live in Princeton. We heard about Princeton, but if you're following this whole meningitis outbreak in Princeton, what does it really mean at the university there? Intimacy. Obviously, all sorts of pieces that have been discussed not only on HIV, but other areas, substance use and substance abuse, and more importantly, which is I think what a lot of us do here, how do we make prudent public policies that helps people make the smart choice, the appropriate choice that's right for them in the right context? So there's a lot that's been going on. On the bottom right is a food pyramid, which is unintelligible to some. There's American football on the left, which some people think should be outlawed. There's all sorts of things to look at. So we think that smarter choices can make a difference. So the next slide puts smart choices in road safety. So we mentioned these road safety accidents, which are huge when you look at the number of 2.4 million fatalities a year. There's been a resolution at the UN General Assembly, and there's a decade of action that's ongoing. So what can be done? Some of these are with other Bretton Woods institutions, such as the World Bank, in terms of road safety management, safer roads and mobility, safer vehicles that are done from private and public sector engagement, safer road users, which is one of the biggest challenges, not only to get people to have a seatbelt in their car, but to make them wear it and use it. And then finally, how quickly can we get a post-crash response? Because it could be as simple as getting people fluids at the site of an accident. So the next slide talks about some new ideas that I think are possible. New technologies. How is it that I know also in this room there are more smartphones than there are watches? How can we use these technologies to make a difference? So as you see, there's been collisions and combinations of things that have happened in the past, but there might be new areas that we can move beyond both the seatbelt and the airbag. And the third piece here is this idea of alcohol interlocks that right now are simple, that you blow into some sort of device that locks your car. If you have, in this country at least, if you have a driving under influence first or second, depending on which state you live in some states not at all. But there's no clear piece with other technologies that are in place for people who don't have those in the car. So there's lots that can be done, and as you see, only 28 countries have appropriate laws that address all of these areas. So this is a place where prudent public policy, smarter choices, and all of this synergistically can make a difference and bend the curve, as we call it, away from those 2.4 million deaths. So the last few slides, I'd like to continue to show that I have a vision with this, that just like when I grew up, seatbelts were not put in cars. They put seatbelts in cars, but people didn't use them. Then they had to put bells and whistles and so forth, and people still didn't use them. Then they put laws in place, and people still didn't use them. But then they had enforcement of those laws in place, and then they had campaigns to enforce those laws to remind people. Now people use safe seatbelts. Same thing with airbags. Now they've become mandatory in all levels. What can we do to think about new technologies in other areas? And as you see, these are proven technologies that have made a difference. The next slide gives an idea with this. And I say this very quickly as you see where we've gone from seatbelts. I don't necessarily think that a pedestrian airbag is going to be the answer. But I give people credit for innovation. The good thing about innovation is it's actually good because 95% certainty is not the threshold, but this is the first generation of where it might be. And then the next slide is the paradigm that we put together for health diplomacy. Allison and I wrote this on behalf of the Innovation Working Group and submitted this as a green paper to the post-millennium or Sustainable Development Goals. And basically we use the same lexicon, as you can see, of the MDGs, for those of you who know the squares and the boxes and the visuals that are used. But we think there's some other pieces to add in here. And look, I'm speaking from the private sector. 11 years before I was at U.S. Agency for International Development, I was in the public sector. Before that, I was in the not-for-profit sector. Before that, the academic sector. All of us have ideas. And we think this health diplomacy paradigm with open communication and collaborative collaboration is the way that we need to have new synergies. And this is the example, and we could provide the white paper as it's mentioned at the bottom. Now, my company tried something, thank you, the next slide's fine, tried something interesting in terms of bridging health literacy, health diplomacy, road safety, and so forth in China. And we launched this on what we call Global Be Responsible Day in 2013. And it was a mini-movie, and there's a famous NBA player named Yao Ming, who's from China, who did what they call a mini-movie, where he and Shanghai police and others put together, what it's like to be a designated driver and how drinking impairs driving. Anyway, the short is that it had private-public partnership, and in a matter of 3 months, 130 million downloads. These numbers are astounding. Now, we just have the downloads. Now, we're hoping, obviously, that it actually changes people's behavior, but without awareness, necessarily can't change behavior. So here's just an example. Also, some of the funding that goes from it goes to build schools, so it ties in the whole health literacy piece, and hopefully we'll have a sustainable outcome. So that, I think, is close to the end. The next slide is my wrap-up, that I think we can make sustainable health a part of post-2015. Health decisions also, determine how well we use our water, how we don't waste water, also how we use our energy. Smarter choices obviously can tie into what we do in daily life. Health education and health literacy should be embedded in schools, not for tomorrow, but for our next generation. And then finally, technology and innovations to advance public-private partnerships for road safety. I think it's something I would like to see happen in my generation. I think we have the wherewithal to do it, and we've got a lot of the people on this panel to help that happen as well. So I'm looking forward to more opportunities. And again, thank you, Dr. Durbach and World Information Transfer and all others to be part of the panel.
Thank you, Dr. Ratson, for a wonderful synopsis of the importance of health and health literacy for all of us. Speaker is Ambassador Thomas Gass, is the Assistant Secretary General for Policy Coordination and Interagency Affairs at the Department of Economic and Social Affairs of the United Nations. Ambassador Gass was appointed as Switzerland's ambassador to Nepal in 2009 and the country director to the Swiss Agency for Development and Cooperation. In Nepal, he was the chair of the donors to the Nepal Peace Trust Fund, the main instrument for international support to Nepal's peace process. and the co-chair with the UN resident coordinator of the Donor Coordination Group. He also served as the Dean of Diplomatic Corps in Nepal. Prior to arriving in Nepal, he served as the head of the Economy and Development section of Switzerland's mission to the United Nations in New York. Ambassador Gass.
Thank you, Dr. Durbach, and Excellencies, Professors, ladies and gentlemen. Allow me, as we are getting to the closing of this conference, to express particular thanks to the government of Ukraine and the World Information Transfer Organization for this initiative and its substantive and refreshing and enlightening contribution to the follow-up of the Rio +20 conference and the shaping of the post-2015 development agenda. Today's conference has touched on vital aspects of the economic, social, environmental dimensions of sustainable development, including sustainable energy, sustainable sanitation, sustainable health, technology for sustainable development, and food insecurity. As my colleague Nikhil Seth pointed out in his opening remarks, this conference helps give concrete form to the term science-policy interface by bringing experts and intergovernmental policy shapers and policy makers together in a space in which we can draw lessons from concrete examples and initiatives. One of the important lessons of Rio +20, which is being reiterated in the deliberations of the Open Working Group on the Sustainable Development Goals, is that the 26+ issues that were identified in the Future We Want outcome document, including health and the environment, need to be discussed and tackled concretely through partnerships in a cross-cutting manner. This was also very much the spirit of today's discussions. Out of today's conference, I see the reaffirmation of a clear health-environment nexus that intersects with other nexuses that have been identified and discussed elsewhere, such as the water-energy-food nexus. Health for all in a sustainable, salubrious environment can only be achieved if there is sustainable energy for all, sustainable water and sanitation for all, and nutritious food for all and access to relevant technology. Health cannot be isolated from all these other factors that influence human health, which in the prosperous parts of this world and the prosperous parts of poor countries are taken for granted. Health and the environment and partnerships for their promotion need to be an integral part of the post-2015 development agenda. By mid-century, we'll be living in a world that may have grown from the present 7 billion to some 10.3 billion people. Already the world population is consuming 1.5 times the annual capacity of the Earth to regenerate itself. We are depleting natural capital rather than regenerating it. Alongside the overconsumption by the fortunate in both rich and poor countries, over 1 billion people are severely deprived in terms of basic needs for health, food, water, energy, sanitation, and education. Accelerating climate change, now confirmed with 95% certainty by the IPCC to be caused by humans, is putting the present and future livelihoods at risk. Increasingly frequent natural disasters, food shortages and rising food prices, scarcer water and deteriorating soils are affecting health and well-being of people everywhere, but most severely in the poorest countries. Accordingly, member states of the UN, as well as major groups and other stakeholders, are relying on 5 guiding principles for the post-2015 development agenda. Firstly, leave no one behind. Secondly, keep sustainable development at the core of the agenda. Thirdly, transform economies for jobs and inclusive growth. Fourthly, build peace and effective, open, accessible institutions for all. And finally, forge a new global partnership. At the center of the post-2015 development agenda are expected to be a set of sustainable development goals. The goals of the new development agenda will need to build on the progress achieved through the Millennium Development Goals, as this was reminded by several speakers today. The Millennium Development Goals have inspired the world to reduce by more than 1/2 the percentage of those living in absolute poverty. Yet, inequality across and within countries, including in access to health and a clean environment, has increased since the dawn of the new millennium. We need to finish the job started by the Millennium Development Goals so as to ensure the social inclusion of all those who are deprived and to protect future generations from deprivation. The new development agenda will need to give special attention to ensuring jobs for all, including, in particular, youth who in some regions face over 50% unemployment. The new development agenda will also need to heal the planet by counteracting the depletion of natural capital through decoupling economic growth from natural resources use. Health for the planet is invariably and directly linked to health for humans. The acute economic and fiscal crisis that most regions face today is leading to reductions in the social safety nets and on which many people depend, including in key sectors such as health and education. Health and education are often the first victims of fiscal austerity in both poor and rich countries. Today's event should play an influential role both through its outcome as well as the work of the individual countries and organizations represented here to ensure a health and environment-sensitive post-2015 development agenda with a set of global partnerships to implement it. Thank you very much.
Thank you, Ambassador Gass, for a very comprehensive summary of the session.